Good Sunday morning and welcome to another edition of At Issue. I'm Corey Smith.
And I'm Sue O'Connell. Coming up, Arthur Jemison, the man Mayor Wu has put in charge of reforming the Boston Planning and Development Agency. He's going to join us.
Plus, should Massachusetts proceed with overdose prevention centers for illegal drug use? State Senator John Keenan has traveled to several cities where these centers are being used. He'll share what he found.
But first, we want to take a look back at what was at issue over the past week.
The Healy administration has revoked essential grants for the town of Milton after voters there rejected an MBTA housing plan.
That law requires MBTA communities to enter a zoning plan for multifamily housing near transit stops.
We're starting to see the impacts of a controversial court ruling that says frozen embryos are children without exception. Today, Alabama's largest medical center is pausing IVF, in vitro fertilization treatments.
Governor Maura Healey's latest Supreme Court nominee is getting flack from the governor's council. Healey nominated appeals court justice Gabrielle Woolahogen. The two previously shared a romantic relationship.
My personal relationship with Judge Woolahogen should not deprive the people of Massachusetts of an outstanding SJC justice.
President Joe Biden has announced more than 500 new sanctions on Russia. Now, this comes in the wake of the war in Ukraine and the death of Russian opposition leader. We're talking about Alexei Navalny.
As a Boston City Councilor and candidate for mayor, Michelle Wu has been clear. She wants to abolish the Boston Planning and Development Agency. The BPDA, as it's known, plays a massive role in shaping Boston, approving everything from the location, size, and scope of developments to planning the future of neighborhoods.
But despite those major responsibilities, the BPDA operates separately from city government. It faces no city council oversight and is funded in part by developers, the same developers who need the agency to approve their projects. So, Mayor Wu wants to create a city planning department, moving the functions and staff of the BPDA under City Hall and under the city budget.
Joining us now to discuss that and so much more is the director of the BPDA and chief of planning for the city of Boston, Arthur Jemison. Arthur, thank you so much for joining us here at Issue. I want to start here. We know there's a city council hearing coming up on the mayor's plan. What are the chief concerns that maybe you have heard from developers or community members about this plan to move planning under the city of Boston and under the city's budget?
Well, first, I appreciate the invitation. I'm glad to be here. What the ordinance is going to do is it's going to bring planning under the budget review and operational review of the council for the first time in over 50 years. And so, in doing that, it's going to create the kind of accountability for this department that every other city department has. So in doing that, I think some of the questions that people I think have rightfully asked is, is the development process and projects that are approvals going to be subject to that same kind of review, or is it still going to go to the BPDA board? And they've also asked, how will the fact of these changes enable more community input and advice about projects? So we've been, I think, able to answer both those questions, specifically highlighting to our development interests that BPDA projects will continue to be approved by the BPDA board in the future, even though the staff are going to be under city jurisdiction. And then on the other side, through this process, as well as through the work we've been doing to reform the Article 80 process, the way we identify the impact of developments, there's a significant aspect there that is changing the way and improving, we think, the way that community members are able to give advice and describe and discuss development.
So I've worked in cities and covered city halls where planning and zoning boards were advisory. Right. They could say, yes, this project should move forward, only to have the city councilors say, no, the project is not going to move forward. And a lot of developers feeling sort of caught in between. Any concern that this move could slow development down in the city of Boston?
I'm not concerned in that same way that this is going to slow development down. The staff of the BPDA have a historic and important role. We're one of the major ways that the city government creates public-private partnership with the development industry and in economic development broadly. So I think there's always going to be that level of attention, the quality of staff. I think that's going to continue. I think that to the extent that anything would change, the most Massachusetts, municipalities have the staff who advance development and the staff who take the actions that a redevelopment authority can take. Those staff are almost always working for the city in a way that's different than the way the BPDA is currently constructed. So I feel like to the extent that it's going to be very similar to the way it has been historically in terms of the quality of staff and what they're bringing forward, it's also going to be the way that it's done in most of the other major cities in the state.
So, of course, I don't think we go 60 seconds without saying housing. We need housing in the state, certainly in Boston. No secret, Mayor Wu, she wants to overhaul the city's zoning code, which in theory could help address that need. And a major part of that is the Squares and Streets initiative, focusing on adding, supporting, and improving housing, public space, small businesses, arts and culture, transit, all of that in the transit accessible neighborhood centers and along the main streets. Now, the city has already identified 18 neighborhood centers and main streets that may be eligible for Squares and Streets zoning. And last month, they revealed the first 4 locations, which you can see on this map. So why is this the best approach to overhauling the city's zoning code?
The reason I think it's the best approach and really topical to your great introduction, great command of the key things we're trying to impact, is because right now, if you wanted to build a 3 or 4 story housing development in one of those squares next to transit, next to open space, next to oftentimes restaurants and supermarkets, you'd have to get a network of different kinds of ZBA and other kinds of approvals, sometimes even zoning commission approvals, which are very difficult to get, in addition to the Article 80 impact review. That's creating real barriers to production of housing. And so what we're trying to do in those squares is say, because of their proximity to all those benefits, let's make it easy for development to happen in those places by creating a predictable path for development that doesn't compromise what communities are asking for in terms of design, in terms of setback, in terms of access to transportation and other parts of the neighborhood. We believe that working together, we can create that kind of predictability for both developers and community members. So that's why it's so important. If we're going to grow in the places that can absorb growth, we need to create a blueprint and create a path that makes it easy to do that. Zoning and the ambiguities around zoning are one of the major concerns and things that delay the production of housing in our state. So we need to take action through Squares and Streets to do that. And we need to do it with neighbors.
So I've heard some concerns, some critics say that this plan might give this mayor or any mayor in the future actually too much power and could lead to the use of the dreaded eminent domain. What are your thoughts on that?
Well, I think I'd like to take those pieces one at a time. So today, the mayor appoints 4 of the 5 board members of the BPDA, and all of the staff of the BPD of that same board that the mayor gets to appoint 4 members of, they all work separate from the city. So if you were concerned that the development arm of the city wasn't sort of didn't have a responsibility or somehow had was detached, you should just look at today's system, because it couldn't be more detached from the way that the rest of the city operates. So at some level, the idea that somehow putting the staff and me and the leadership and others under the council's review is actually kind of a revolutionary change in the way that the function of planning and development in the city is operated. So I think that's actually a little bit of a misnomer or maybe a misunderstanding of what's being proposed. On the other side, eminent domain is something that we're actually is very fundamental to the list of concerns that most citizens have about the agency. And so in that vein, we've taken the action to have a home rule petition that's now being considered at the State House that would mean that we can only use eminent domain for certain kinds of activities. Today, we can use it for something called blight, decadence, and and substandard housing, in the future we'll only be able to use it for affordability, equity, and resilience, protecting our coastal edge. So I think eminent domain is not something that I think is likely to be used in the context of squares or streets or any of the other zoning reform. But again, if people want there to be more accountability for me and my team, having us continue to report to our board, but be staff of the city is a major step forward in that effort.
So when we talk to Mayor Wu about housing, one part is building new housing, obviously, but then there's this idea about converting commercial buildings into housing. Last week, the Boston Business Journal reported that there has been some progress on that front. When you're out there talking to developers about this idea of converting commercial buildings that aren't necessarily wired from a plumbing standpoint to actually be housing, are they expressing interest in trying to make this happen?
They are, increasingly so. And just to kind of paint a very sort of small portrait of what's happening there, particularly affecting sort of smaller, older office buildings, which are owned by, have owners who have owned them for a long time often, and lenders who are sort of small regional lenders, and they're looking at the potential valuation loss, with a really keen eye. And the idea of saying, I'm going to take my historic building that has been functioning one way, I'm going to turn it into a totally different land use, and then get it permitted and go through all the processes that every other housing development goes through, is something that they're beginning to kind of wrap their head around. I think it's helped that we've offered a tax incentive to do that. We're beginning to get more and more interest in proposals in it, because the impact of the value change is beginning to really affect them. But we've got a whole SWAT team and our organization designed to help them. And so anyone who's looking at it should definitely come in. They're going to get a high level of attention. The opportunity to turn these buildings, again, a lot of them historic, beautiful old mid-size office buildings from a particular generation, late 19th, early 20th century. These buildings have got great capacity to be turned into residential and have such great proximity to all the amenities of living in a downtown. I think there's going to be even more interest as time goes on and as people begin to realize that their value is changing. But I think we're getting people to slowly even become more interested. I think we're just under 200 units now, and we're expecting a few more proposals in the next few months to boost that number closer to the 300 we were estimating initially.
I would ask you about a recent report from the Boston Policy Institute saying that Boston will likely lose nearly $1.5 billion in tax revenue over the next 5 years due to empty office spaces. Of course, the reason being empty office space lowers the value of commercial real estate, which in turn, of course, lowers the amount of revenue the city takes in from commercial property taxes. What can you say about this report? How much of a concern is it to you and everyone else?
So I haven't had a chance to review that specific report, but what I have been doing with our colleagues in the CFO's office and the assessor's office and the mayor and some of our Boston delegation at the State House is we called together a series of property owners and business leaders and asked for their opinions about the issue and how we can tackle it. We have sort of an emergent strategy that we've been cultivating that I think is going to provide ways for us to address this challenge. But it is a real challenge. The fact of office buildings losing value and the impact it has on the way that the kind of taxes and the portion of the tax base that we can collect these critical revenues from is an important issue, and it has an impact on the business climate. So that's one of the reasons we spent time researching it, identifying some best practices, the way that this issue has been addressed in other challenges to the market from in earlier years, and then importantly, calling together property owners, developers, and talking with them as well as some citizens about the different routes we can take to address the issue. And so we're really, I think, over the next few months, you'll hear a lot more about the ways we want to tackle it.
Well, we're certainly glad to continue the conversation here on At Issue. Arthur, thank you so much for joining us. We really do appreciate you taking the time. And of course, you can see much more of our interview with Arthur Jemison on NBC10Boston.com/@issue. All right, coming up, safe consumption sites in Massachusetts. What would happen if they opened up here?
A state lawmaker visited several North American cities to see how these facilities work and what happens in neighborhoods where they're set up. That lawmaker and a public health expert join us to talk about the pros and cons. Coming up.
Welcome back to At Issue. We want to have a very important conversation and look at the deadly impact of drugs in Massachusetts. According to the State Department of Public Health, the rate of opioid-related overdose deaths in the Bay State has increased at a rate of 3% per year on average from 2015 to 2022.
So what can we do to prevent more deaths? 5 years ago, the Massachusetts Medical Society endorsed a pilot program for supervised consumption of drugs. A survey last year found 70% of state voters support passing legislation to allow cities and towns to establish such sites. But legislation on this concept hasn't made it very far on Beacon Hill.
So these overdose prevention sites are operating in several cities across North America, including Quebec City, Montreal, Toronto, Vancouver, and New York City. There's also a proposed site in Philadelphia. Joining us to talk about these centers, State Senator John Keenan of Quincy. He recently visited those consumption sites and wrote an op-ed in the Boston Globe about what he found. The senator joins us here in studio, along with Dr. Brandon Marshall, the chair of epidemiology at Brown University's School of Public Health and a leading researcher on overdose prevention centers. Thank you so much for being here, both of you. Really appreciate it.
Thank you. Good to be here.
I want to start with you, Senator. Tell us what you found. You know, the op-ed that you wrote in the Boston Globe, required reading for anyone who wants to know more about this issue. You visited these sites. Where did you go? What did you see inside the sites?
Sure. So I visited them because I had done a lot of research knowing that these sites work. And as I talked to people, the question I heard all the time was, what will they do to a neighborhood? And so I went up to the site in Montreal. There's a couple sites up there. I went out to Vancouver, visited the sites that are located in the downtown east side of Vancouver, visited a site in Toronto, and visited a site in Quebec City. Also went down and visited the two sites in New York City and traveled to Philadelphia to see where they were going to locate them before they encountered some legal obstacles. What I found was that if it's done properly, they fit into the character of a neighborhood. And the data rather suggests that they won't have a negative impact in terms of crime rates and public use. That stuff still occurs. It doesn't eliminate all that. But if done right, these centers save lives. They move people towards treatment. There's harm reduction in terms of the spread of communicable diseases. There's all of that, and it can be done without negatively impacting a neighborhood.
So we're watching a lot of battles in the news right now in Massachusetts over where it can go what with stadiums and train tracks and housing and zoning, and battles about things that we kind of all agree on, which is what the big obstacle here is. How did those sites end up in the neighborhoods that you visited?
It seems that they were focused on need. Where is there kind of a critical mass or critical need for this? And the locations really are determined by that. And what the data shows is that people won't really travel all that far to go to use one of these sites because they're in such a condition that they really won't. So it's really, where is the need? Where is there a critical mass of people who are injecting drugs or inhaling drugs and are at risk of overdose death? And that is the place where they best work.
Doctor, tell us about the data. What have you found? What makes these centers, these safe injection sites, effective?
Yeah, we've seen a lot of literature and scientific research from all over the world, from Canada, from Europe. We know that they're effective at managing overdoses on site. We know that there's never been an overdose death at any overdose prevention center anywhere in the world. And they're highly effective at engaging with people and connecting them to healthcare and addiction treatment resources. Like the senator mentioned, too, we also know that they improve the neighborhood conditions in the communities in which they're located. They reduce the number of people using drugs in public, and they reduce the amount of drug paraphernalia and drug-related litter, for example.
So one of the places we went for information on this topic is to your website that you and your team at Brown have set up for people to look at the facts and research on safe injection sites. It's opcinfo.org. So what have you found when it comes to people who use the drugs at these facilities and whether or not they end up enrolling in substance abuse treatments? Is there treatment available at the sites? What happens? What's the transaction that happens to get from using it in a safe site to getting into treatment?
Yeah, so much about this is developing relationships with people who use these sites. The staff on site are excellent. They work with people. They develop that rapport with program clients to say, how can we help you? What kind of health care could you benefit from? Are you interested in treatment? And it's those relationships which are so critical at connecting people. We know that the more frequently someone uses an overdose prevention center, the more likely they are to enter into some kind of treatment. And often treatment, whether that be medications or actual residential programs, can be co-located in the overdose prevention center itself.
Senator, what did you see in terms of that treatment piece of it? I think some folks will look at that and say, maybe this is just lip service, like I'm just required to let you know that treatment is out there, but my number one goal is to make sure you stay alive, which obviously is a very important goal. In the cities and the sites that you visited, did you see a real effort to say, I understand you're here to use, I get that, but treatment is out there, and that is a better thing to go to, not just come to the sites to make sure you don't die?
I think the doctor said it's all about the relationship building. And I was in the injection room in New York City and saw a person ask for help. And there was an immediate kind of warm handoff as the person requested treatment. And it happened right there, right before my eyes. It wasn't staged or anything else. It was real. And a person who had been a long-time user just got to the point where said, I'm ready for help. And because of the relationship that had been formed, help was right there. And that person felt comfortable in asking for it at that location. And then the transition occurs.
So obviously, I know this is a complex issue, but if you can briefly give us your elevator pitch, because like affordable housing, other things, you're going to run into the NIMBYs out there who are saying, I get you're trying to keep people alive, but you're also enabling drug use. So what is the pitch to say Massachusetts is ready to bring these centers to the Bay State and they can be effective?
Given the number of overdose deaths that we have, we've tried a lot of different things. We've been successful with a lot of it, yet we still have an increasing number of overdose deaths. So it's time to try something different. And I think it's important to convey that this isn't a statewide mandate. Absolutely, it would be a local decision whether to host one of these sites. And we have communities that are interested. And so the legislation would give them the ability to open one. In terms of enabling people, I spent time literally on the streets and in doorways, on benches, bus stops, watching people. And it's terrible to see the condition that some people are in. And I would suggest that there's nothing that we could do that would enable them given the situation that they're in. When somebody is literally living in a gutter, injecting while, on a sidewalk, having a site isn't going to enable them any more than they feel they must use it. Having that site might save their life, might help stop the spread of diseases in the neighborhood, and gives them hope that they will be referred to appropriate treatment. And so I think that's really what's critical to realize.
Doctor, one of the things that I learned on your site and on your fact sheet was the amount of money that we spend, the taxpayers spend, dealing with this issue the way it is right now. What's the argument around someone saying, perhaps, look, I don't want to fund this safe injection site. I don't want to spend any more money on this problem. What's the answer to that?
Yeah, that's exactly right. These sites save lives. They also save money. One report from the Institute for Clinical and Economic Review found that even one site in Boston could save taxpayers more than $4 million annually. And those savings accrue because of primarily prevented ambulance runs and hospital visits that can be averted when overdoses are managed effectively on site. So that's such an important point. We hear all the time about our strained healthcare system. These are sites that allow people to get more effective and appropriate management for overdoses on site that then relieve that strain on emergency departments' EMS services.
So, well, certainly a fascinating conversation, and to your earlier point, something has to be done about the amount of opioid deaths happening in Massachusetts. So we'll see where this goes. Senator Keenan, we appreciate the time.
Thank you.
Dr. Marshall, we appreciate the time as well.
Thank you.
That's it for this week's show. But remember, you can always listen to us when we're not on air. The Taking Issue podcast dropped on Friday. Sue, Matt, and I talked about Milton's vote against complying with the MBTA Communities Act, as well as the presidential race. You can listen at NBC10Boston.com/@issue, or you can stream episodes wherever you get your favorite podcasts. As for next Sunday, we're going to take a closer look at the troubles for hospitals owned by Steward Healthcare, the massive financial issues it's facing, the concerns for patients and employees, and the potential impact on communities that could be left behind. We're going to dive into it all. That is next week, though. As for this week, that is it for At Issue. Thanks for joining us. I'm Corey Smith.
And I'm Sue O'Connell. Have a great day.